for 5 minutes.
Thank you, Madam Chair. We have a massive problem. We just got done talking about the budget and talking about the deficit, but there is no possible way to address that without addressing health care. Health care is the biggest spending item for the government. One out of every $5 spent by the government is spent on health care, and it is the quickest growing inflationary cost to Americans. Right now, if you consider Medicaid and Medicare, you consider the amount of money we spend on private pay, which is about 1/5 the economy also, in a GDP of roughly $24 trillion, you're spending $6 trillion on healthcare alone. If it were taken by itself, it would be the third largest GDP in the world. It would have twice the GDP size of India, which has 1.47 billion people. This is a massive problem. So what are we going to do? How do we take on something so complex? I think it's an underserved problem in the United States Congress. We've been kicking the can down the street for far too long, both from the Clinton administration all the way through the Obama administration. The Affordable Care Act did nothing to make it affordable. We've done nothing to curb the inflationary costs. And it's certainly not the doctors' problem, because doctors took a 2.3% pay cut last year alone. If you're an ER doctor in Georgia, you probably took about an 18% pay decrease in 1 year. And that's after serving during COVID for 3 years, on nights, weekends, and holidays. That is your congratulations. So how do we address this? Quite frankly, we're going to have to make some hard choices. And America has to understand, first of all, how complex this issue is. When you have PBMs, GPOs, pharmaceutical companies, insurance companies, Medicaid, Medicare, when you have the government involved, private pay, when you have hospital systems, when you have healthcare providers. These are just some of the problems we have. Right now we have 90% of the ingredients that go into drugs produced in China. You have almost all the market for amoxicillin and Augmentin cornered by an adversarial nation. We have admin costs that have grown in the hospital system from 25% to 40% just in the last 10 years. Take that into account. 40% of every dollar spent on healthcare is spent on administrative costs. That means too much regulatory burden. That means not enough competition. And we continue to talk about a single-payer system as the end-all, be-all to healthcare. Let's take that into account right now. Medicaid is done at a loss. It doesn't pay the bills. As a matter of fact, we have an act right now that talks about supplementing people with a tax break so that they can actually see more Medicaid patients and afford it and stay open. It's not the answer. If we go to a single-payer system, you're talking about adding $30 trillion of expense to the government in the next 10 years. That means $30 trillion more in either tax or debt. We've pretty much lost our minds over $32 trillion of debt that we're already in. Imagine adding $32 trillion more to spending. It would be the largest increase in spending and government control there's ever been in American history. We have a massive problem. On top of that, despite spending about $32 billion on electronic medical records and spending a lot of money on coders, we still have 45% in many cases of claims not being reimbursed by insurance companies. This simply can't continue to happen. People are using their insurance companies the wrong ways. If we use car insurance the same way we use healthcare insurance, you'd be spending your car insurance to actually change your car oil, and it would probably cost about $500 per pop, and you wouldn't be able to afford car insurance. We need to look at this in a different way. The problem is, if I talk about cutting administrative costs to medicine, people will immediately vilify me for trying to cut Medicaid and Medicare. This is why it has to be a bipartisan issue. We have to have a real conversation, and it can't be about calling people names, but about actually solving a problem. If we want to talk about a real solution, I think we have to start thinking about not just taking this as subcommittees, not just a subcommittee of E&C, not just a subcommittee of Ways and Means, not just a subcommittee of VA or a subcommittee of Foreign Affairs, but we actually have to have staff that are dedicated to a process that's so complex, so big, has so many lobbyists involved, that it's almost impossible for a physician with an MBA to figure out how to handle it himself. This is something we're going to have to take as a problem that all of us have to solve without vilifying each other. And if we don't do it soon, we will increase government, increase spending, and we will have rationing simultaneously. If you don't want,
time is up.
Final point, if you want a good example of single-payer system, the VA is exactly what you're going to get. And it is not popular. With that, I yield.